how would you approach HRT, which is hormone replacement therapy? Where would you start to say, okay, you know what, you're somebody who should consider HRT? Like, what are the indicators?
So there's a questionnaire called the Adam questionnaire, which is actually pretty legit. If you answer three or more yes to those, there's a good chance that you are suffering from or you are experiencing low testosterone levels and they're affecting you on a day-to-day basis. So we start always in medicine with just talking to a patient. What's going on? What are your concerns? So after that discussion, it's important at this point then to actually dive in and do a little bit of a work on a patient. Get some lab work, get some blood work on them. It could be as simple as just looking at the hormone panel. Where are your hormone levels right now? The problem with that method is it would be great to know what their hormone levels were 10 years ago. Do you know what I mean? Because
Yeah.
now you need a benchmark.
You know what? That's a great point you bring up right there because I hadn't actually thought of that one. Correct me if I'm wrong, but the normal range would be from 300 to 900, generally speaking.
I think it should be even a little higher. I think that 1200 is not an abnormal number, especially if you're talking about a younger man.
And so then when people, when they do the blood workup and I see that they have a 600 testosterone level, well, I say, you know what? I mean, that's not bad. In theory, I would say, you could consider it, but it's just if you want to take it to the next level. But I'm not thinking about, man, maybe 10 years ago, their testosterone level was 1200 and now you're underperforming because you performed significantly higher at a different period in history.